Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez, your host, again, for another important health topic. In 1986, President Reagan deemed March Hemophilia Month. Hemophilia is a blood disorder. And over the next 30 years, that month and that awareness has really been broadened into blood awareness, Blood Disorders Month. So now in March, we're celebrating, we're creating awareness, we're trying to educate our population, our community about blood disorders. And of course, if you're going to talk about blood disorders, you need to bring an expert, somebody who knows about blood disorders. And in our medical field, blood disorders are dealt with by hematologists. A hematologist deals with blood disorders. You may or may not know, you have probably 1 to 2 gallons of blood in your body. And so we brought my friend, my colleague, Dr. Steve Fein.
Hi there, Dr. Gonzalez.
All righty. Steve, well, welcome. Steve, tell us, I told the audience a little bit about blood disorders and hematologists. Tell us what a hematologist does.
Yeah, the hematologist, it's in some cases, it's kind of a mystery solver. The hematologist solves problems that are related to bleeding and clotting and abnormal blood counts, sometimes things that don't make you feel sick, but it's something that we can discover when we talk to you or review your blood test results.
All right. So we're talking today about blood disorders, and why don't you go over with us some of the common blood disorders that exist in our population? I understand that there's 3 million Americans that suffer from blood disorders. So what are some common blood disorders that we see in our community, you see in your practice?
Yes. So historically, blood disorders were divided into things that were cancer-like, like leukemia things, and now a little more focus on the non-cancer blood disorders that we call benign hematology. Blood disorders for benign hematology are very common. Iron deficiency is very common, many million people. And other blood disorders, a little less common, like things with low blood counts, the thing called ITP with low platelet count, clotting disorders, clotting tendency, like having a DVT blood clot. These are the kinds of things that affect a few million Americans, which is pretty common.
All right. So if somebody's listening to us, can they tell at home that there's some warning signs that they may have a blood disorder?
The idea of a clotting problem, that's an important problem that causes people to have discomfort. For example, leg swelling associated with a blood clot. That's something that you need to get attention for and something you'd feel. On the other hand, some of the other blood disorders with blood counts are very slow and subtle, and you don't know it until you get a checkup or a hematologist tells you there's a problem in the blood.
Okay. And one of the issues that we see a lot of times is in women is heavy menstrual bleeding. And we're going to get into anemia. I see that you have that iron on your shirt, and, this is Iron Man. You guys know Iron Man. You've heard of Iron Man, I guess, is a Marvel. Yeah. But we have the real Iron Man here, and we're going to talk about iron deficiency as well. But I see this in my practice with bariatric surgical patients because I send you those patients to deal with them even before surgery and after surgery. Heavy menstrual cycles. Let's talk about heavy menstrual cycles a little bit.
It turns out as many as 30% of women who have menstrual bleeding have significant enough volume of bleeding that they end up with iron deficiency. We call this a bleeding tendency or bleeding disorder, and some of them are defined as a real bleeding disorder, like there's a special one called von Willebrand disease, von Willebrand disorder. But many women don't have that label and still have so much bleeding that they end up tired, fatigued. There's such a thing as having ice craving related to having very low iron. And this is a problem affecting so many women, and women just don't even realize it until it gets to a point where they end up seeing the doctor finally and kind of really late in the game.
And so what can we do, or what can women do about that heavy menstrual bleeding?
Yeah, so as a hematologist, one of my major specialties is to explain and help people manage bleeding tendency or bleeding disorder. For example, identifying a woman to have the disorder called von Willebrand disorder, or to have a female version of the thing called hemophilia. These are things I can help identify. Another thing we can do is try treatments to help slow down bleeding and decrease the volume and make it so that the woman doesn't lose so much iron each month, and also that she has a better quality of life. And the most important thing I do is to help identify who is so low on iron that they need an iron treatment or an iron infusion.
And so obviously, if a woman is concerned, the first step is what? Get some blood tests?
It all starts with blood tests. So a woman who's tired has to go for blood testing. It's so routine that people expect to have blood tests to help figure out what's wrong with them. The blood counts, for example, the count called the hemoglobin will tell you whether your blood count is normal or whether you've lost enough blood and enough iron so that you're not able to make blood. And then a secondary test is the iron test, which is the main one's called the ferritin test. So an iron test will tell you whether or not the iron is deplete for the whole body's iron level.
All right. So then if a woman finds out they have anemia, their blood count is low, they have low iron, then the treatment is not only replenishing their iron, but it's also stopping the bleeding.
We have to try to stop the bleeding. There are easy treatments now compared to even 10, 15 years ago. The treatments are easy. We use a common one we use is a pill called TXA or tranexamic acid. We use that all the time to help slow down bleeding. Also hormone medications, historically, oral contraceptive type medications, estrogen type medications are helpful for women. And finally, if those medications are not adequate, there are procedures that help slow down bleeding or stop bleeding.
All right. And then on the other side, you have to replenish their iron. Talk to us a little bit. We were talking before we started the show about iron infusion. Talk to us about this iron infusion and the need for it. Apparently, there's a huge need.
It turns out about a third of women who have menstrual bleeding have low iron and need an infusion to replenish their iron or sustain and feel better. And also about a third of pregnant women need an iron infusion to have enough iron to go through the pregnancy and develop a normal, healthy baby. It's so common now to need iron that the need for it is unmet for most of the country. So, what happens is that a woman who needs iron might wind up seeing a hematology doctor who sometimes is also a cancer specialist, get an iron infusion in that setting, or sometimes in a hospital setting. Our team developed an iron infusion center that's just dedicated to women's health so that we can have women come in a setting that's just focused on women's health. And we do iron infusions, and a woman will feel a lot better if she needs iron and gets an infusion.
So talk to us a little bit about those iron infusions. How long does it take? How many do you need? And so forth. And, obviously the benefits, you're saying you feel better. Are there any negative aspects of that?
Yeah. So iron turns out to be a very important medication. It's only been the past 10 years that it's become easy and feasible to give iron like we do now. The most common need is about 1,000 milligrams worth of iron. And only these past 10 years has it been easy to give that 1,000 milligrams, either as one sitting, one hour infusion, or in some cases we give lower dose at a time depending on certain situations. So sometimes we give 200 milligrams at a time and come a few times for an iron infusion. Either way, the total's 1,000. We give that iron over either one sitting or a few weeks. And within a short period of time, a woman who's tired from low iron will feel much, much better.
Are there any negative impacts of getting iron?
The only thing is that every so often we see a reaction, kind of like an allergic type reaction or discomfort. It turns out, we're studying this because we do so many infusions. It turns out about 5%, about 1 in 20 women who receive an iron infusion have a discomfort reaction like flushing sensation or nausea. It's very temporary and we get everybody through it. The long-term benefit is always a good outcome.
Yeah, right. Of course, it's you need the iron, so obviously the benefits outweigh the risks.
That's the way we see it. And remember, iron is needed for all your muscles to contract. So it's not just about a blood count, although it's a blood disorder, but it's all your muscles in your body and all the cells in your body. Your brain needs iron to function. Iron is needed to make ATP. That's the science of it, to contract a muscle and to enable all your cells to do their functions.
Wow, so Iron Man is really important. All right, so we've covered iron, and then let's cover some of the bleeding disorders. Somebody goes get their wisdom tooth out, or somebody is brushing their teeth and they see that their gums are bleeding a lot, or they have excessive bleeding in other areas. Is there something that should be concerned about?
So this is the thing. A lot of people have a bleeding tendency. It's kind of a spectrum where you bleed a little more easily than other people. For example, a woman with a heavier period than the average woman. Some people have such an extreme amount of bleeding tendency that a procedure that we view as not such a big deal, like having a tooth extraction, wisdom teeth that most people end up getting, if you bleed more than a few hours or more than sort of like a day's worth of minor bleeding, that's significant. It shows that you have a bleeding tendency or even something we might call a bleeding disorder, especially if it gets to the point where you're needing to get help because you're bleeding so much. Now, that's wisdom teeth. That's a thing where many of us go through it and we see that that's a thing. The key is that that would be a flag that down the road, if you end up having a procedure, like many people eventually need another surgery or an injury, that you'd know that there's something about you that makes you bleed easy. And we can do some testing to figure out and label what is that disorder.
Yeah, and it's important to catch it very early in that regard, right? When you're having a smaller procedure as opposed to when you're having a bigger procedure, right?
It is. So one thing that happens is that a child may go through childhood and have nosebleeds every so often, and people kind of don't get excited about it. Just something that happens to some kids. But then as they get to be older and they have a procedure, wisdom tooth extraction, and we look back and say, well, you had a nosebleed once a month as a kid, it becomes more obvious that maybe they had a bleeding disorder that wasn't labeled or figured out. And it didn't ruin their life as a kid. But one day, as they get older, for example, a woman who's going to have a pregnancy and deliver a baby, it'll be something that becomes a bigger deal. So it'd be great to figure out what it is and actually be able to take steps to prevent excessive bleeding.
Okay. And is there anything good about having a bleeding disorder?
The way I see it as a hematologist, people either have more of a bleeding tendency or more of a clotting tendency. And I view clotting, all of us would agree, as something more serious, like, for example, having DVT blood clot or heart attack or stroke. These are things that are life-altering and life-limiting, whereas in general, bleeding is not so bad for most people. So when I say what could be good about a bleeding disorder, when I tell somebody, I say that maybe they're protected or less likely to have an important blood clot. And it's something we do think, because imagine if you're a blood clotting person, if you're somebody with blood clots, our mission is to actually convert you into somebody who bleeds easy by giving you blood thinners. So instead of saying, let's give everybody blood thinners, we'll embrace the people who bleed a little more easily and say that they're kind of naturally blood thinning, and maybe they're not going to have a heart attack or stroke.
All right. So we talked a little bit about the anemia. We talked about the bleeding tendencies and those that bleed a little bit more. Now, if somebody has a bleeding disorder, or they're concerned they may have a bleeding disorder, and they're going to have surgery, elective surgery, whether it be cosmetic surgery, or they're going to maybe have a colonoscopy, and maybe you're going to remove a polyp and there may be bleeding. Is there something that they should be doing?
Yeah. We're in an era where we have some tools that can help minimize bleeding and avoid excessive bleeding. And at the very least, once we identify that somebody has bleeding, we can stop bleeding pretty easily. So we have tools. The simplest one I mentioned is TXA. That's something being used for heavy menstrual bleeding. Now we use it before and after surgery, before and after a delivery or a C-section for a woman who has heavy bleeding, a bleeding tendency. So we have tools. There are stronger tools, for example, people who have hemophilia, the disorder where your body's missing a blood clotting factor. We can supply that clotting factor as a treatment. So we have these tools. The key is, as we've said, to identify who needs these tools and use them the best we can.
Yeah, and I know you keep mentioning TXA, and we're using a lot of that TXA because obviously we give anticoagulation to prevent blood clots around the time of surgery, because that's a very high risk of blood clots, but at the same time they can bleed from surgery. So it's interesting that TXA is also being used in what we call an outpatient setting as well.
It's caught on. In fact, TXA, a different brand name was Lystida these past 15 years. That was approved 15 years ago by the FDA as a treatment for heavy menstrual bleeding.
Wow.
And it's taken this long for it to catch on and to become so well accepted and common. And now I prescribe TXA every single day to a woman with heavy bleeding.
Wow, incredible. Now, is bleeding from the gastrointestinal tract, like you're bleeding through your rectum, you're bleeding with your bowel movements, is that the same as these bleeding disorders that you're talking about?
You know, it's kind of different. A young person, a young adult who has bleeding, heavy menstrual bleeding, maybe nosebleeds, maybe bruising, these are disorders that tend to be something you were born with, and we may or may not be able to label it. Whereas in general, things where you bleed in the intestines and the GI tract and have bleeding when you go to the bathroom, that tends to be something people get as they get older. And it usually has something to do with having mild or maybe more significant liver dysfunction. Not always, but usually. And that's something people get as they get older, either just because they're older or sometimes related to heavy alcohol use in some cases, or other causes of liver dysfunction. Sometimes we identify it and sometimes we don't. There are other cases where somebody has bleeding from, for example, a polyp in the intestines, or as people get older, they get the entity called diverticulosis. So these are things, but again, it's things that tend to be older and things that are acquired. whereas the bruising and bleeding of wisdom teeth and pregnancy are younger hereditary things.
Now, as you mentioned, a bleeding tendency could be good because as I'm thinking, if you have God forbid, a polyp in your colon and you have a bleeding tendency, you're more likely to bleed and show signs of that polyp earlier than somebody who doesn't have a bleeding tendency. And so you and I know if you're not getting your colonoscopies regularly and all of a sudden you got blood in your stools, you're going to go get your colonoscopy and you may have had a polyp diagnosed and cured of a cancer as opposed to somebody who doesn't have a bleeding tendency. So, I mean, I'm starting to believe that bleeding tendencies could be good.
You're in the hematology mindset, Dr. Gonzalez. So, and this has been a story for a while now that people who take anticoagulants get figured out earlier. They used to call it a provocative test where you give someone heparin or you use the blood thinners that we use, the pills. And if they have bleeding on the pills, then, hey, they figured out earlier that they have a problem that needs attention. But it may extend beyond that. It may be anybody with a bleeding tendency.
Yeah, of course. So don't forget to get your colonoscopies. Obviously, if you're bleeding through your GI tract, through your rectum and your stools, get your colonoscopy, get your endoscopy. You could have a bleeding tendency, which you'll have to see Dr. Fein for that, but you also may have a polyp that's bleeding as well. So obviously that's very, very important. Now you mentioned bruising. Somebody says they bruise. And I know that fragility of the skin as you get younger, there's more bruising. But talk to us about maybe a young person who's bruising or an elderly person who's bruising. What about that? Is that significant?
All the time I'm asked, what does it mean that I bruise easy? And, people get nervous about it. There's such a thing as having a bruising problem that is important and something that needs to be figured out right away, like an emergency type thing. For the most part, it's not an emergency. Most people who bruise easy, it may have been something that they were born with, or in some cases, you're born with a tendency to bruise, but you don't really get into it until you get a little older, 20s, 30s, that you start to your body changes and you become more of a person who bruises. And it's something very subtle and slow. And I tell people, even though they might find it to be ugly, that I view it as healthy because it's that thing where they're less likely to have a blood clot if they're more of a bleeder. Now, on the other hand, somebody who's not really a bruiser and all of a sudden starts to get important bruising, a bruise out of nowhere, especially didn't hurt yourself, just came out of nowhere, spontaneous bruising, we say, that's important. It needs to get checked out. The number one thing we'll check is the actual platelet count in the blood, a blood disorder, to see whether somebody has developed the condition called ITP, a common condition. 10,000 people a year develop that. So that would be something we think about even in a young person. On the other hand, older people who develop urgent new bleeding or bruising, they need the same kind of attention right away to get a blood count. In those cases, we're looking to see if they have a blood cancer like leukemia. Either way, important to get checked. Usually bruising doesn't excite me or bother me. I tell people don't worry, but we have to always check it out.
Yeah, no, you really focused on that area, that if somebody is not usually having heavy menstrual bleedings and all of a sudden they start with something, they're heavy, things have changed, then that has to be investigated.
A change is always something that should be investigated, but when it comes to bleeding and bruising, definitely need to check it out. At the very least, I'll have somebody go for blood counts to a CBC blood count, just to know that their platelet count is not low and that they don't have the thing called ITP or the thing called leukemia.
Right. You mentioned a couple of times ITP. Let's talk a little bit about ITP. Let's talk about platelets. We're talking about blood disorders, and a platelet is obviously part of the blood. So tell our audience a little bit about what a platelet is and what ITP is.
Yeah, thanks, Dr. Gonzalez. There are three different types of cells in the bloodstream. We have the white blood cells that are mostly thought of as your immune system, the red blood cells mostly thought of as the oxygen-carrying cells, and the platelets, which are mostly thought of as cells that help prevent bleeding. So your body has a certain amount of platelets. Our usual platelet count is something like 200,000 cells per microliter in the blood. Now, there are conditions where your body makes too few or too many platelets. And these are blood disorders that I would be involved with helping you figure it out and managing it. There's such a thing as having a blood disorder where your body's platelet count goes all the way down very low, even all the way down to zero. It sounds that scary because your platelet count is supposed to be 200,000. It can go all the way down to zero. It doesn't actually mean that you have no platelets. It just means that your body makes them and eliminates them so fast that you can't detect them when you measure it. It needs to be treated if it's that kind of thing. And it's something where you would have bleeding and bruising as a new finding or a new problem. and you need to get that platelet count fixed in order to avoid bleeding and bruising. We have treatments for it. But that's a condition that affects 10,000 people, newly diagnosed people every year. And some people live with it as a chronic thing. 40,000 Americans live with that.
Wow, incredible. And then you also mentioned hemophilia. Tell us a little bit about hemophilia and what hemophilia is. I know there's different types, of course, right?
Yep. So hemophilia is the thing that most people think of when you hear about bleeding disorder and you've had some knowledge about the diseases that were identified as a bleeding disorder disease. The important and interesting thing about hemophilia, which is sort of the most well understood and known bleeding disorder, is that it's almost always in men, because it's a disorder that's inherited on the X chromosome. And remember that men only have one X chromosome. So it would be much more likely for a man to have a problem with this if they have one mutation, one X chromosome. So hemophilia is in men. It turns out 20,000 people in the United States live with this disorder, and it can be so severe and disabling because they have bleeding just all the time in their joints, in their elbows and their hips and their knees. And it gets to be disabling. So we have treatments to help minimize that disability, but it's very challenging to be on top of that. Now, that hemophilia disorder, and that one also is called hemophilia A. That's where your body's missing a clotting protein, the one called factor VIII. There are other similar versions. There's one called hemophilia B where you're missing factor IX. And now the one that's called hemophilia C is where you're missing factor 11. This actually is not X-linked, and it turns out that men and women get this, but it's a milder thing. It is one of the things that causes bleeding tendency, like we've already mentioned about heavy periods. So we test for that, the factor 11 thing. And finally, women who are carriers of hemophilia. So a man has the disease, but a woman who's a carrier and could give it to her son, she has a bleeding tendency just by virtue of the fact that she's a carrier. So we're starting to rename this whole thing and say that somebody who is just a carrier might actually be ill with it or might be affected by it and have a bleeding tendency that we're calling hemophilia carrier disorder, or even just call it female hemophilia.
Wow. And that was what actually President Reagan in 1986 wanted to bring awareness to, was hemophilia. And of course, is expanded it. So we've learned about a hematologist. You guys not only try to figure out, you made a comment at the very beginning that you're trying to figure out the problem. You do try to figure out what the bleeding problem is, what the clotting problem is, why do they have anemia, help them. You also help them fix their problem. You help them with their bleeding tendencies. You help them with their clotting tendencies as well. So what is in the future of hematology? What is the next step for your world and your patients?
Just like all of medicine, the future is bright for hematology in ways that are similar to other specialties. We have gene mutation testing now, so we can better identify somebody's disorder that they were born with. And we have treatments that are called monoclonal antibodies. That's already been around for 30 years, but more modern ones that are very effective at solving immunologic-based blood disorders. We have better treatments for the thing called leukemia, which is a major problem for hematology. And now I'll go back to the iron thing. We have a better and easier treatments to treat iron deficiency, which it sounds like something not quite as complex or modern as gene therapy kinds of things, but iron treatments are now so easy and accessible and feasible to give that we're in a position where we should identify and treat everybody who's got low iron, and that's a modern and future part of our world.
Yeah, and that's obviously going to make patients feel better. It's going to give them more red blood cells. The red blood cells are what's going to carry their oxygen around and make them circulate to their brain, to their hearts. So obviously very, very important. Any closing thoughts or recommendations for our community on Blood Disorder Month?
Blood Disorder Month. Everybody's got gallons of blood, so we all have the potential to have a blood disorder. So important to get checked out by your primary doctor to get the blood tests that they might recommend, and then see a hematologist if there's even a hint of a blood disorder, blood concern. I recommend that all women get iron testing every year as a screening maneuver to see whether their iron is adequate. And of course, all pregnant women at 26 weeks. And last but not least, all patients who've had gastric bypass or
bariatric surgery,
any weight loss surgery. after a year or two, very important that they have their iron tested periodically because it'll become depleted.
Yeah, and it's very important. We do that a few times a year as part of our bariatric surgical program, but obviously patients get lost, they forget, they leave, they graduate after 5 years. So it's very, very important to get tested. So I think very, very important. So obviously, and one of the things I remember and I've learned from today is that if there's anything new or different, more bleeding than usual, new bleeding that you haven't had, bruising that you haven't had, that has to be evaluated
Check it
immediately,
out.
right?
Blood counts and possibly tests for bleeding tendency or bleeding disorder.
All right. So March is Blood Disorder Month. Bring awareness to it. Talk to your friends and family. Thank you, Steve Fein.
My pleasure.
Thank you for coming.
Dr. Gonzalez.
Iron Man, Steve Fein, Dr. Steve Fein, coming to teach us about blood disorders. Once again, Dr. Anthony Gonzalez from Miami Community Health. Remember to take care of yourself and your